The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are here for the next episode of TMD Demystified, and I am Tony Urbanic. Today, we're going to be talking about what's so important about separating the back teeth. What's so important about separating the back teeth? Now, if this is your first episode, you may have to catch up a little bit and go back to some of the other 170 episodes where I talk about how and why a device that separates the back teeth works. We're going to touch on that today, but there's certainly a lot of information on that in the other episodes. But today, we're going to just focus on what's so important about separating the back teeth. I'm going to kind of pull it all together so that you can apply it. If you wish, you can apply it to your patients who have TMD. And in some cases, it may encourage you to become network providers so that you can actually do the Urbanic device and protocol for your patients, which has been seen and found to be so successful and proven by independent university study. So let me start off by telling you a little story. I think I may have mentioned it on one of the earlier episodes. It's buried in there somewhere. 170 episodes is pretty hard to keep track of it all. But early in my experience, after determining how a device that only occludes with the front teeth and separates the back teeth works, I had a patient who came in all the way from Knoxville to Nashville. That's about a 4-hour drive. And she presented with the usual plethora of symptoms: headache, earache, jaw pain, neck pain, for 30 years. She was a middle-aged woman, typical 30-year history of these symptoms. And I didn't recognize it at the time, but I could tell, certainly looking back on the experience, that she was quite upset by the fact that she had all these symptoms and no one could help her. And this is pretty typical. We see a lot of 10, 20, 30-year-old, 1, 2, 3 decade patients who have these symptoms, who have been run around in circles for years and seen many, many different kinds of doctors and attempted many different kinds of treatment. In any case, because she had driven, and this was early on, I had probably been only using the device in my own practice. This is long before we got the patent and developed a company. So I felt compelled, because she had driven so long, to give her extra service. And I had made sure I had plenty of time, and we had a rather lengthy consultation. And I explained to her all the different things that I had learned and how the device works. And then I thought, well, she probably would appreciate knowing how I actually, quote, stumbled on to the method and stumbled on to actually what I had discovered. And I told her the story about interviewing a couple dozen patients over a period of several months and just listening to their history and listening to what they had to say about the problem, which is actually the way I began the research. Instead of reading more journals, reading more textbooks on TMJ, TMD, going to more congresses, and certainly doing more surgery, which by that time I had completely stopped doing any additional TMJ surgery, I began interviewing these ladies, almost all females, 90% females, and just sat and listened to them about what they had to say about the problem and encouraged them to speak. And some of them needed encouragement, some of them didn't. But I would say, what does your husband think about it? What are the symptoms? What do you think that you can add to help in understanding the problem? What phase of the moon is it when it hurts? Does the dog bark when it hurts? What can you tell me about this problem? And I would sit there and just listen until the patient just didn't have anything else to say. And out of 24 ladies, roughly half of them, 12 of them, said something very similar. If I take a pencil eraser, my tongue, my finger, a piece of cloth, small piece of rubber, and put it in between my front teeth and gently bite down, it feels better. It makes it feel better. And actually that led me to making the first device, which led me to making many devices, which led to where we are today. But the point is that is actually how the patients gave me the key as to where to look. And then I had to figure out how it worked. But anyway, I shared that story with this patient who had driven 4 hours from Knoxville, Tennessee to see me because she had heard there was a doctor in Nashville who had some kind of device or service that might be able to help her with her TMJ symptoms, as we know, TMJ symptoms. So after I shared that story with her, and I thought I was, had the time and was happy to do it, she looked at me kind of very quizzically, and she said, quote, "Dr. Urbanek, do you mean that if I hold a pencil between my front teeth, it will make my symptoms go away?" And without thinking, I immediately answered, well, yes, if you can figure out a way to hold a pencil between your front teeth 24/7 for 2 months and then nighttime only the rest of your life, which is the protocol we worked out how to use it, it's going to make your symptoms go away. And she hesitated for a minute, and now her quizzical look came to a glare. And she glared at me, and I knew right then I had kind of gone over the boundary of some kind. And I didn't know what to say. And quickly after that, I finished the consultation. And after later in the afternoon, I had learned that when she left the consultation and walked to the front of the office, she did not even stop at the financial advisor's desk office, which is always the next step. If the patient is invited and has a diagnosis and invited to do the service, is the next step as a financial advisor. And she walked right past the office and out the door. Now, I learned a lot from that experience. Number one, I learned to be very careful in how I address patients who have a long-standing history of symptoms that are ruining their life. I thought I was being a little humorous, and you have to be careful sometimes. What you think is humorous may actually insult another patient. And actually, I tried to contact her again by telephone and or email, and I got no responses. I wanted to apologize or at least explain that I was just being humorous, and I certainly meant no disrespect at all. But I believe with that experience, she felt disrespected. But it is that simple. And I think that maybe in this case, I at this point, I don't know anything to say about it, and I don't completely have it figured out, but I do think that one way or another, this patient felt disrespected by the simplicity of what I said. But it is truly that simple. If you can disocclude the posterior teeth long enough and consistently enough, it will allow the chronic inflammation within the temporomandibular joint to decrease. Just like a set of crutches, if you have a bad knee of any kind, damage to the knee of any kind, which creates inflammation within the joint, if you put the patient on crutches, the inflammation will decrease. And as the inflammation decreases, the pain goes away. As you recall from your pathology course in dental school, pain is an integral factor, integral part of inflammation, along with swelling, along with dysfunction, and along with increased temperature. Those are the parameters, the basic parameters of inflammation, which, as it turns out, is an extremely complicated issue. Inflammation is a complicated issue, but how to decrease inflammation is not. So you don't have to know a lot about the complicated issues of inflammation. All you have to know that is if you have a bad joint, a damaged joint, a joint with chronic inflammation, basically all you have to do is unload the joint, because the chronic inflammation is either caused directly by or influenced by or stimulated by overloading the joint. If you have a bad joint, knee, hip, elbow, tennis elbow, it's all about too much use, overloading the joint one way or another, which creates the inflammation. And because inflammation, chronic inflammation, literally drives and is responsible directly for each of these symptoms, then when you make the inflammation goes away, the symptoms go away. So what's so important about separating the back teeth? Well, that's what's so important. You have to separate the back teeth to allow the inflammation to decrease. Now, for a first-time viewer, I just want to emphasize that a protocol that separates the back teeth in an adult for only 2 months does not allow super eruption of the posterior teeth, either maxillary or mandibular, because the patient certainly has to spend a certain amount of time each day chewing, and so that disocclusion of the posterior teeth only for 2 months will not allow posterior super eruption. On the other hand, it is well known that if you disocclude posterior teeth for any length of time without supervision, that you can get super eruption of posterior teeth, especially maxillary teeth, because the bone is softer. And it can happen, and I have seen that, but not by use of that device with proper supervision and protocol. Now, in children and adolescents, you have to be more careful because bone moves more rapidly through soft bone. And that is taken consideration when we treat adolescents and children as early as age 11 or 12 in some cases, which is, I think, reason for another episode, topic for another episode. But the issue of super eruption does not occur in adults in 2 months. And then nighttime, the rest of your life, the patient is spending 2/3 of their time in centric occlusion of some kind, and you don't have to worry about super eruption once they go to nighttime or sleep time. So that is what is so important about separating the back teeth. It actually makes the whole process work successfully. It's that simple. Now, we have seen, once I got down the road with this and I had patent on our device, which does not direct the mandible anywhere. All it does is separate the back teeth, and only the canine and or incisors touch, allowing the posterior back teeth to separate. We have seen Several, actually many, been experienced with many providers who try to make homemade devices, which I don't necessarily discourage, but I don't encourage it, because we get to see in this practice many patients who come in with doctor-made homemade devices. Getting back to my patient who I told, yeah, if you can figure out a way to hold a pencil between your front teeth or a pencil eraser between your front teeth for 24/7 and then nighttime only the rest of your life, you will get the response, because that's all there is to it. It's a simple mechanical advantage, a mechanical effort to unload the joint, and you can do that when the back teeth don't touch. On the other hand, as I said, we have an increasing number of doctors who I'm aware of that listen to our episodes and try to duplicate what we have with this device by taking a suck down on the occlusion and putting a wad of plastic across, a wad of acrylic across the anteriors. Again, I don't encourage it. I don't necessarily discourage it. You're not violating the patent as long as you don't make it look exactly like our device. But the point is that what we find is that the doctors who do this don't pay any attention to the protocol, and the device itself, for the most part that we've seen, is not patient-friendly. They find it very difficult to speak in with just a wad of acrylic across the front of a suck down, and in some cases very hard to hold in place, and definitely not something that the patient would want to wear 24/7 for a while. And that is why the protocol is so very important. You have to start out, if you want to get a good response, and want to get the patient educated on how to use it, and you want to get the patient to have the best benefit of using a device that separates posterior teeth and unloads the joint, they have to start out 24/7, because inflammation does not change that rapidly, especially chronic inflammation that has been going on inside a joint for 10, 20, or 30 years. Which brings me to a point, little side issue here, and that is I actually did episode number 100, where I selected 17 cases who had just terribly looking x-ray. I mean, significant damage to the temporomandibular joint architecture, bony surfaces, where you had hockey sticks rather than condyles, and significant damage to the joint. But each of those patients who, in my prior experience doing surgery on the joints, would have easily been recommended to have surgery of one kind or another, because there was so much damage to the joint. Each one of those 17 patients exhibited significant improvement and actually reached the 85, 95, 100% level of symptom relief just by disoccluding the posterior teeth and decreasing inflammation. So it has nothing to do with how much the damage is done to the joint, what the x-ray looks like. You can have a terrible looking x-ray, you know the joints are inflamed, but if you unload the joint, no matter how much bone loss you have, you're going to get the same result, which is decreased symptoms. And unloading the joint at first 24/7 is extremely important, because it does take a little time for the chronic inflammation to decrease, and the body's own, let's just call them healing services about chronic inflammation, and allow the chronic inflammation to disperse. You're not trying to build bone. You're not trying to make an x-ray look different, because you won't. All you're trying to do is allow the inflammation to decrease. So that is why it is so important to separate the back teeth, and why homemade devices actually, and that's how it all started, a homemade device. The patient saying, if I can put it, when I put a pencil eraser between my front teeth and gently bite down, it feels better. So homemade devices are not effective, because you have to wear them 24/7. They can't force the mandible in any particular position. The whole experience is to allow the mandible to retrude, if necessary, back to its most comfortable centric relation. Another word for centric relation is rest position, resting the joint, and then going to nighttime. And it's a big if, but then if a patient exhibits a functional malocclusion, which is definitely possible if there is, to start with, a significant difference between centric relation and centric occlusion, then and only then should the patient be referred for or treated with a combination of orthodontics and orthognathic surgery as necessary, or occlusal if just small changes are seen with large symptom exhibits. Then maybe just a significant occlusal equilibration may be necessary in some cases, or maybe in some cases occlusal reconstruction, but don't trade occlusal reconstruction for orthodontics and orthognathic surgery. There's only so far that you can get with an occlusal reconstruction, and certainly reconstructing 28 teeth is not conservative therapy in any way, shape, or form, which leads me to the statement that orthognathic surgery combined with the assistance of a good orthodontist is really the way to go when you observe a significant centric relation, centric occlusion discrepancy, which is one of the causes of chronic inflammation within the temporomandibular joint. All right, I've made my point about homemade devices, whether it be patient homemade devices or doctor homemade devices. One more thing about the doctor homemade devices. Again, I don't encourage you to do it, but if you want to do it, I won't stop you as long as you don't violate the patent. And if you violate the patent, what really will happen is the state board will get a letter, because it's not only civilly illegal, but it's unethical. And then you can deal with the state board if you try to violate the patent. All right, I would like anyone who would like to comment on my episode here to certainly contact me. I'm happy to talk with you. I'm happy to share emails. I'm happy to get on the phone with you. If you'd like to learn more about how to become a provider and do this service for your patient to a high success rate and value to your practice also, you can learn more at www.urbanictmj.com. I can be reached at tony@tmjservices.net. Anytime you'd like to, I am available to communicate. I look forward to our next episode, and I look forward to teaching you, the dental provider, how to treat TMD, TMJ successfully. Until then, I'm Tony Urbanic, and this is TMD Demystified.